Stuart, what is your take? Is the goal to get the American people to lose faith in those institutions, or is it that the midterms are less than 100 days away? Republicans cannot run on policies. They cannot run on the economy. They cannot run on immigration. They certainly cannot run on the war. But what they would like to potentially use this for is, well, you better stick with us because these other guys simply suck.
I think the answer to your question is yes. It's both. This is one of the more sad, bizarre moments in the whole Trump history, which is like no small achievement. I mean, we live in a country today where it's unsafe to eat a salad. And we have a guy who's in charge of our national health, who was a longtime heroin addict, who defends being a heroin addict, saying it worked for him. A guy who has talked about snorting cocaine off a toilet seat versus Anthony Fauci. You have Rand Paul, who's a second-generation nut. His father was a nut. He's a nut who has this obsession, some sort of like Jodie Foster obsession with Fauci. And look, the man there saved uncountable number of lives, not just in America, but around the world. And, you know, I've said that there were two traits to the post-World War II Republican Party, Joe McCarthy and Dwight Eisenhower. Dwight Eisenhower was governing, boring. McCarthy was conspiratorial, nutty, non-governing. What we're seeing here is a replay of the Joe McCarthy hearings. That didn't end up well for McCarthy. I don't think this will end up well for Rand Paul, but it's still a very sad day.
Do you think it's going to end up unwell for Anthony Fauci?
Yeah, it's so sad to see this man up there who's done so much good, has dedicated his life to him, to saving lives. Look, every day we wake up with, can they really go this low? It's sort of a constant in the Trump administration. And it's what just shows, what Rand Paul just shows, just how unserious Republican Party is about governing. And it's these kind of collection of weirdos and cranks have emerged to the top of the party, and it's playing out in color. I don't think this is something that Americans look at and feel good about.
I want to bring into the conversation Dr. Vin Gupta, MS Now senior medical analyst and pulmonologist. Vin, as soon as this hearing started, I sort of couldn't believe my eyes, and I immediately said, call Vin, because throughout those days and weeks and months when we were all home and scared, and this once-in-a-lifetime pandemic was changing rapidly, we were losing friends and family members. You were one of the people we went to and relied on. So fast forward to where we are this morning. You're watching the same hearing we are. How do you feel, and what do we need to know? Because this is going to cause many, many people to start questioning a lot of things.
Well, Steph, thank you for having me back. And I remember those mornings with you in this hour much earlier on the West Coast. And what I would say is I'm glad you started there. I'm here in an ICU right now. And you and I and some of the senators were talking about the human toll. So let's start there. 1.3 million estimated human lives lost here just in the United States, up to 22 million based on the estimate you want to use worldwide. So there's a real human toll here, and that's not getting spoken enough about in this testimony. So, and that's why you and I talk so much during the pandemic, the human costs. I would also say, just for everybody's awareness, since there's a lot of noise, there's nothing in Dr. Fauci's personal diary or his prior statement, Steph, that is providing any new news here. We have no new insights or anything incriminating or anything that he has concealed on, say, COVID origins. There's nothing new from an insight perspective from his daily musings. Yes, they've given some headlines. Yes, I'm sure there's certain things that he wouldn't have wanted to come to light. But is there anything actual substantive that helps us better prepare for the next pandemic? No. I'd also say that it's easier to subpoena yesterday than it is to actually solve today's problems. And that's what a lot of your other commentators are notating. That's what some of the senators were notating. We have this cyclospora outbreak that we never have had to talk about, Steph. You and I have not had to talk about that in prior years because we have had a foodborne disease surveillance system in place that works to catch that early. Measles, obviously, we've lost elimination status. It can go on. But this is a useful distraction for the current times that we live in. Again, easier to subpoena yesterday than to solve today. We can talk endlessly about COVID's origins and the debate there. It's an accountability and a transparency effort that I do believe is important for us to be able to move on from this chapter. So there are some important questions here. I thought Senator Lankford, just to call him out, was asking future-focused questions, and he was doing so in a calm, rational way. If we could get some of those answers at some point in a forum intended to actually help us move forward as a country, perhaps he can be a part of that. I thought Senator Ron Johnson, just to close here, Steph, shows and highlights the unserious nature of some of the senators on this panel. He's talking about, quote unquote, ivermectin working. Let's be clear. You and I would talk about this in 2020 through 2022. Ivermectin, small early stage studies in the early days of the pandemic showed a potential small benefit for COVID critically ill patients. What then happened afterwards? Well, Steph, this is what happens often in science. Larger randomized controlled trials looked at ivermectin in those same patients, and they showed no clinically meaningful benefit towards preventing hospitalizations, transmissions, or reducing deaths. Very clear. There is no uncertainty here. And yet he's talking about ivermectin working. He's talking about linking a vaccine that Dr. Fauci took to pulmonary infarctions. I can go on, but he is proving himself to be unserious on this panel. But I will again say, Senator Lankford asking important questions.
Republican senator from Oklahoma. But for those who are watching, and they're watching their senators cast doubt in the vaccine, should anyone now rethink the safety and importance of taking it?
No, because if anything, Steph, they're highlighting a correlation between, say, Dr. Fauci taking a vaccine, then many months later, for his own report, developing a pulmonary infarction. I'm a pulmonologist. I can speak to this with some authority. There is no credible evidence that's been proven to show that a COVID vaccine is linked to a pulmonary infarction. What's an infarction of your lungs? It means part of your lung tissue has died because maybe there's been an embolism or a blood clot. I know that's what's often gets cited in some parts of media. There's no linkage. So they're grasping at straws at things that have been disproven. Frankly, COVID, this reminds me of the conversations we had 5 years ago, is more likely to cause some of those side effects than the vaccine itself. So no, Steph, to answer your question directly, there's nothing new here. We're relitigating things we've already talked about. And by the way, this CDC, this NIH is hiding evidence. They're not wanting to publish evidence to the American people, actually continuing to show the durable impact, positive impact of COVID and reducing hospitalizations, especially amongst children. They actually hid the publication of that stuff. So
and
no, if anything, we've seen more benefit.
Why would they be motivated to do that? And I promise I'm getting to the squad here. We're moving on. But why would they do that?
Well, because it doesn't fit the narrative that we're seeing play out right now on Capitol Hill. If they publish that and then this is the side screen stuff, then how does the American people, how do their own audiences navigate and reconcile that reality? If their own CDC is publishing data showcasing the benefit and safety of COVID vaccines, and then here we are having this side by side, doesn't make any sense.
Vin, thank you. Christina, what is your take on all of this?
It's so frustrating.
There's a lot in that.
Yeah, just because this entire administration is so exhausting. And remember when Joe Biden got elected in 2020, and so many of us breathed a sigh of relief, and we didn't realize how much we were holding in for 4 years, and now we're back, and it's even worse.
Well, much of that exhaustion, when Joe Biden won, much of it was people were like, enough with this COVID circus. Yes. Can we just get to some normalcy?
Yeah, and actually, work on healing the American public, hiring and appointing, public servants that actually know what they're doing, not the likes of Robert Kennedy Jr. So to have an American public servant sort of sit here and have to look at Josh Hawley grandstanding and, deal with so many Republicans just disavowing the work that he not just did during COVID, but obviously the decades before. He's worked under several administrations. It is exhausting. And I think, as so many Democratic senators said, we're not talking about measles. We're not talking about the rise of so many, I always forget the name of it, but, the short-term poop lettuce, right? We're not talking about the war in Iran. Where's the Epstein files? We haven't even talked about that. We're not talking about the rampant corruption of Donald Trump and the members of his family and the administration. We're not talking about a series of failures of not just the president and his administration and hyper-corruption. We are relitigating something from 5 years ago. And again, Vaughn, as you said, there are certain questions that we should ask and answer just in case we ever see another pandemic. But this is not it. This is nowhere near it. And so the frustration that I'm feeling is that the level of unseriousness and disrespect, not just for Dr. Fauci, but for the American people who are struggling at the gas pump, who are struggling at the grocery store, who are struggling with housing prices. I mean, we're really in a crisis, and the president, quite honestly, doesn't care. I mean, I don't know if he's cognizant enough to even know what's going on.
No, but this will now get conjured up to be a new crisis, right? I can see Laura Ingraham sitting behind Anthony Fauci. Right. And while I'm not privy to the plannings of her daily news program, I'm pretty sure
make assumptions.
This is going to be the focus for the foreseeable future.